So today we're going to go over a few basic things. I'm going to share my screen with you, and we're going to go over a few things. We're going to go over vitamins and minerals today. So I want to just um kind of train you guys or kind of help you out so you understand this, because I know I didn't understand it when I first started doing this. But anyway, we want to talk about vitamins and so what are vitamins and what are minerals? And vitamins are substances that are found in food and the food we eat, okay? And then there's water soluble vitamins. Those are vitamins that dissolve in water. They're not stored in the body. And then there are our fat soluble vitamins. And those are your vitamins A, D, E, and K. And those can be stored, and they can be stored in fat, that can be stored in the body. So you don't need those. You need them, but your body can store them. Okay. So there's two types of vitamins: water soluble and fat soluble. Water soluble, they come in and go out, they do their job, they get right back out right here. They go in, do their job, and get back out. The fat soluble, they're stored in the body's fat tissues and liver, and we can use them later. Okay. So that's vitamins. Now, in minerals, we have, minerals are basically, they're inorganic elements, which means they come from non-living sources. They're absorbed by plants and eaten by animals, and then we ingest them later. So when we look at this, we have minerals, we have macro minerals and micro minerals. And your macro minerals, those are the ones you need more than 100 milligrams. Those are things like the calcium, the phosphorus, the magnesium, the potassium, the sodium. These are big. These are like, you have to have these. The micro minerals are things that we miss out on. These are the things like, I see a lot of people with thyroid issues or men with prostate issues. And those are things like zinc, iodine, selenium, copper, manganese, and fluoride. Those are your micro minerals. Okay. So just want to kind of get you familiar with that. You have vitamins and you have minerals, and you need them all, but there's a couple different sources of them. So, and then we're going to pick on one. Your most vitamin D and B12 are the most common vitamin deficiencies in the US today. Okay. Just so you know. So when you hear people talking vitamin B12, that's one of the most common ones. And vitamin D is one of the most common ones. Now, D is a fat soluble vitamin, and vitamin B12 is a water soluble vitamin. So now you know that. So those are the two most common in the United States. And then we'll get into what they do. We're going to talk about vitamin D. Here we go. 41% of the people in the US have a vitamin D deficiency. Now, vitamin D is huge. We can get it from the sun, but we don't get enough. Okay. And if you were to go out on the beach on a sunny day, we've talked about this before, on a sunny day, you would probably get about 20,000 to 30,000 units, maybe, of vitamin D on a sunny day at the beach in your bathing suit. So you can't really overdo it, but if you did that, that'd be a 30 to 40 minutes and you'd get all the vitamin D you needed for the day. Okay. But most people are deficient, even if they live in the southern areas, because they're not going to the beach every day in a bathing suit. So most people are deficient. I'm deficient. And some levels I want to talk about. So maybe you can understand this. If you go to the doctor and you get your vitamin D levels tested, they're going to be looking at levels. They're going to say anything over 30 is normal. Anything over 30 is normal. But what I want to tell you is, no, we really want to be above 70. Try to be between 70 and 100 on vitamin D levels. So, and I'll lead you to that stuff. I always want to just kind of preach to you guys so that when you do go to the doctor and you ask for these tests, you kind of know what normal is. Because when people go to the doctor and get their vitamin D levels tested, you're getting them tested with all the other people getting them tested. Who gets vitamin D levels tested? Probably sick people. Most sick people are getting their blood levels tested. And that's the bell curve. So they're going off all that. So 41% of the people in the United States are vitamin D deficient. Okay. So what happens if you're vitamin D deficient? Well, you suffer from fatigue, frequent illness because your immune system's down, bone pain because your bones hurt, they're weak, muscle weakness or pain, mood changes like depression, and then slower wound healing. One of the big things I notice with people is fatigue and mood changes, like depression. It seems like I get a lot of younger women. When I say younger, I'm talking like late teens, early 20s. And if they're depressed, we always look at their vitamin D levels. and they typically have vitamin D levels below 30. Okay. That gives you an idea. So you want to watch those levels, and they're typically going to go down in the winter time because you're not getting the sun. So that's why you'd want to supplement. And I'll show you which one I prescribe the patients I deal with. And so then what are the benefits of vitamin D? Well, supporting bone health. It helps regulating calcium and phosphorus levels in the blood and promoting mineral absorption by the gut, which is good. Strengthening the immune system, that's good. Promoting heart and brain health, which is good. It's an anti-inflammatory, antioxidant, and
Mm.
neuroprotective, has neuroprotective properties and reduce the risk of certain diseases, improving mood and aiding in weight management. So vitamin D is really good. I'm just going to go here, and this is an article I found, and the vitamin D3 benefits, glowing skin, heart health, and more. But if you look at this, bone health, your immune system, this is what vitamin D helps with, mental health, muscle function, cardiovascular health, metabolic health. This is when people can't lose weight or they become a type 2 diabetic. Glowing skin, everybody wants glowing skin, especially the ladies. Cognitive function. Okay, so it's going to help us think clear. Digestive health. A lot of women can't get pregnant, but you want your vitamin D levels when you're pregnant. You want them up. You want that baby to be good. Cancer prevention because it's an antioxidant. Weight management. So those are just to name a few. So one of the things that I go through here, I recommend vitamin D3 with K2. And one of the reasons I do that is because D3 works well with K2, and I'm giving them a ton of vitamin D3 here. Most people take in maybe 800 to 1,000 with their vitamin or their multivitamin. We're giving them 10,000 units right here. Okay. And then we're using zinc. Zinc is for all new cell growth, boron, which helps with that too. And then we're giving them, they call it M7, it's K2 M7, and that is K2. K2 helps grab the calcium from the vessel and put it in the bone where it's needed. So you get good, strong bone health. Okay. So again, this is a good one. This is the one I take. This is the one I prescribe for most of my patients. If you guys are interested, we'll put it in the links and you can get it. The reason I'm talking about D3 and K2 right now is because we're coming into the winter time. And that's when people's immune systems go down. That's when we're susceptible to viruses and bacteria, colds, all that stuff. So if you're traveling or you're going anywhere, I relate the times I got sick, and I almost relate it back when I traveled, like when I was on an airplane or something like that, because you're stuck in that tube with all these people coughing and doing all that stuff, or you're going to church and people are coughing and sneezing all over the place, and your immune system's down. And so that's why you want those vitamin D levels up.